I'm Dr. Jensen Morton. I'm the Director of Health Institutions, and today we're at the Cardin home. So the department, which is the institution-based health services, it consists of 4 institutions in St. Kitts: JNF General Hospital, Hodgson Hospital, the Mary Child's Hospital, and also the Cardin home. And although a lot of people focus very strongly on JNF General Hospital because it is the largest subsidiary in the entire Department of Institution-Based Health Services, the Cardin home is also something that is our primary responsibility. So the Cardin home is located here, right in the village, just down the road from the hospital. And sometimes it suffers from a bit of neglect, not habitually in most occasions, but simply because it tends to be its own world and its own entity. And a lot of times, since it's tightly intertwined with charities, persons in the past would have just allowed the charity organizations to really take the lead with regards to aspects of its maintenance and upkeep. JNF General Hospital staff decided to reach out to the Ministry of Constituency Empowerment, and they very generously decided to partner with us to get one project ongoing, which is a project just to paint and refresh the external side of the Cardin home, just so that it's a more pleasant place. The environs having that refreshment, it actually can do a lot for the psyche of the persons that live here, as well as for persons in the surrounding communities to view it more as a place that gets the respect that it deserves. Now, that's not the only thing that's happening here. We have instituted physiotherapy for the first time in the Cardin home, and there's actually a full-blown physiotherapist that is here full-time to ensure that the residents of the Cardin home are able to get the necessary amounts of exercise. For the first time as well, we have licensed nutritionists at the Cardin home, such that the persons that are there can get properly tapered diets depending on the background situation in terms of their medical situation, types of medications that they're taking, etc. All of the staff members that assist patients, they now are fully certified persons from the Clarence Fitzroy Bryant College's elder care course, and that's now a prerequisite to become a care attendant at the Cardin home, which is something that was also recently implemented for the sake of the safety and well-being of the patients that are here. There's some construction that's taking place on the western part of the Cardin home, where we have a unit that we house some individuals that are a little bit more disruptive than the rest, and thus they need to be kept in places with a little bit more individualization and isolation. That entire unit is now being redone for the first time since its original construction way back in the early 1900s. It's finally now being redone such that it can be up to the level of international standards. So the Cardin home is not a place that we're forgetting, and as we continue to improve it, we'll ensure to keep the general public up to date with the developments. Thank you.